Good morning, everyone, and welcome back to the Stroudwater Associates 6th Annual Critical Access Conference. As we begin week 2 of the conference, thank you for joining us again as we continue with two practical real-world conversations focused on the challenges and opportunities facing rural healthcare providers today. At Stroudwater, we work exclusively with rural hospitals nationwide. Our team includes former rural hospital CEOs, financial leaders, clinicians, operators, and strategic advisors who understand firsthand the realities of rural healthcare organizations are navigating every day. Throughout the conference, rural healthcare leaders and industry experts have been sharing practical strategies, lessons learned, and real world approaches hospitals are actively implementing to strengthen operations, improve sustainability, and better support communities they serve. Today's session will focus on rural health data strategy, physician succession planning, and grant development, all areas playing an increasingly important role in long term rural healthcare sustainability and transformation planning. Our first session today is Data to Dollars, using rural health data to strengthen grants, advocacy, and transformation planning. We'll begin day 4 with a session focused on how rural healthcare organizations can better use data to support strategic planning, funding opportunities, and advocacy efforts. As transformation funding opportunities continue emerging through rural healthcare, organizations are increasingly being asked to support decisions and investments with localized, actionable data. In this session, Keith Bublow, Senior Analyst at Stroudwater Associates, alongside Tim Gibbs, Director and Principal Investigator at Delaware Health Force, Patty Beauchamp, Vice President at Aspire Arizona Foundation, and Jolene Robichaud, Director of External Relations at Stroudwater Capital Partners, will explore how organizations are leveraging rural health data to strengthen grant applications, support rural transformation planning efforts, and guide strategic conversations at both the organizational and community level. Together, they'll share practical examples of how rural hospitals and healthcare organizations are utilizing data visualizations, community health insights, and demographic analysis to support funding strategy and advocacy initiatives and long term transformation planning. Handing it over to you, Keith.
All right, Amy, thank you very much. And welcome back to our conference here. As we said, this focuses, how to take available data and use it to support your funding, your advocacy and strategic direction. Rural hospitals are being asked to support decisions and funding requests, long-term planning, things like that with localized data. As a data analyst myself, I know how difficult it is to get the data, to source the data, to kind of manipulate the data, not manipulate, but put it together so you can use it. And luckily with Stroudwater's dashboard that we created in partnership with NRHA and with NOSORH, we have a free resource that you can use. So we're going to talk about that dashboard. I'm going to show you kind of how it works, how to download the data, what the data is. And that there's a little bit of a demo. And then, as we said, we have with us Tim and Patty, who have either used the dashboard or have some experience with grant writing and with rural advocacy, with workforce development. And I wanted to bring those on to get their opinions and their input on this. So with that, let me just ask Tim, can you give us a quick background of yourself and your organization?
Right. So good morning, everybody. My name is Tim Gibbs. I'm an employee of the state's Delaware Academy of Medicine and Public Health, and now director of a program that is joint between the state and the academy called Delaware Health Force. Like Keith, I have been a data person for most of my career, one way or another. And what we realized from a shortage perspective, long before we were talking about rural health transformation, was that we were lagging behind in primary care and dental care and behavioral health care, and that we needed some good data to back up decision making. So this took us on a path to partner with the Division of Professional Regulation in Delaware that underwrites and licenses a majority of the broad healthcare workforce. And their charge by the state is not to do analytics, merely to license. So we've taken on that role, and it's grown from there. Then enter COVID-19, the pandemic, that exacerbated existing shortages. And then on the heels of that, the availability of rural health transformation funds. At the same time, but we've seen something extraordinary in Sussex County, Delaware, which is our big rural area, which is that a lot of people have discovered it's a great place to retire to. So demographically, it's shifting very, very rapidly, and grabbing onto and holding good information has proven much easier with tools like what Stroudwater provides. Thanks.
Thank you, Tim. And then we have Patty from Arizona. Patty, I know you wear a couple of hats, many hats. You want to tell us about your different hats?
Yeah, certainly, Keith. Thank you. My name's Patty Beecham. As Keith said, I'm a grant and technical writer, and I'm based in Payson, Arizona. I serve on the board of Integrated Rural Healthcare. It's a nonprofit, so I'm a volunteer, and I work very closely with Ponderosa Family Care. It's a rural health clinic, also in the same area, and my work really focuses on using rural health data, including Stroudwater's dashboard, and I use that to strengthen grants. I also use it to support planning, like expansion sites, for instance. We're in the process of going through that decision. And I also advocate for expanded access to healthcare.
Great, thank you, and thank you both for joining us. And then we also have another person, Jolene, who is my colleague here at Stroudwater, our capital partner side. And she is also an expert in grant writing, and she is hosting a session at 1 o'clock Eastern time today that is kind of related to this. And Jolene, you want to give us a quick background about that presentation?
Yeah, I'm happy to. So I will be hosting a session later on writing sort of compelling grants in a really competitive landscape. And so we're going to focus on targeting grants. We're going to focus on taking data and the numbers and really making those work. And then we're going to focus on crafting a really compelling narrative that actually ends up winning grants. And also, we're going to talk about strategy in there. So there's something for beginners all the way through advanced in there. We are going to touch on the congressional dashboard in there. Keith is going to join us for that, as well as looking at other data sources and how to sort of take those all together and make them work for you. So I hope you can join.
Great, thank you. And if you're registered for this session, you can go to that other session just by joining the Zoom lobby, I believe. So please join us later for that. And there's one in between that if you want to join that too. I think we'd be good. All right. So I think with that, we have our first polling question just to get us started here. So how does your organization primarily use data for decision-making, funding requests, or long-term planning? All right, give it a few more seconds here. Patty, while they're answering, could you give us your insight on how you would answer these?
Yes. So probably number one is my number one, because it's so important that before we go into a community, for instance, for expansion, we have to first of all do a level of assessment, because we have to understand the community's needs and gaps. So that would be my number one. But definitely when I'm doing grant writing, then I would be very much so in the space of number two for my narratives and my data. But really, I find myself getting into all of these, but primarily one and two.
All right, Tim, how do you find what were your answers for that?
So my option is not listed, but it's all of the above, but in different ways. I think that one of the things that the Stroudwater dashboard does so well is it opens up the thought process. It opens up everyone's mind to different ways we could be approaching this more, if you will, comprehensively. And these questions and their answers all come into play at one point or another in, responding to an RFP like the one from CMS. And Delaware did well. We were in the top 5 largest per capita in the country. And I believe that it was in large part the strength of the data that we could bring to bear with your help and with the help of a lot of other data sources.
Great. Thank you very much. All right, let's move on here for the all right, so about this dashboard, I'm gonna let's talk about. So we created it as a comprehensive. It's a free resource of rural health data. It's rural specific, and this it was kind of came from the NRHA's 3 focus pillars, which are infrastructure, workforce, and equity. And then we've expanded from that. So what we wanted to do is have rural specific facts, and it's by the congressional district because originally it was used for advocacy. But a lot of the stuff is either at a very local level, or you can look at it from a county level in some of the measures, and we'll get to that. We wanted to use recognizable and publicly available data. So nothing in here is proprietary. It's all publicly available. You can get it in other sources, and in some cases, you may want to go to the original source if you need something that's a little bit more detailed, and also to provide timely information, critical information on again those infrastructure utilization outcomes, and then other factors that are affecting specifically rural communities. And again, putting it all in one place was key. Like I said before, I know how difficult it is to kind of gather everything. So this is very helpful. And we actually use this at Stroudwater, a variation of it when we do our market assessments or strategic planning for our clients, for all our clients. So it first came out in 2024, and we update it semi-annually based on feedback that we get from users and needs, and then when the data is available. So this is what we found is kind of driving this presentation too, is that people are using this dashboard. So a lot of community presentations, local clubs, understanding the communities, what's going on, gaps, grant writing, policy messaging, understanding your patients, your rural patients. So these are some of the feedback we've got, and then to share with our legislators, which is what we wanted to do. Sharing along with our own state data viz tools. I think that might be Tim's response. And then applying for grants, including the RTF grants. All right, so let's do another polling question before we get into it here. How familiar are you with this dashboard? All of us are familiar with it on the panelist here, hopefully. All right. Looks like most people have heard about it, or this is their first time hearing about it, which is good because I've given this presentation before, and you probably don't want to hear it again if you hear so. All right. Looks good. Okay, let's move on. Great. Okay, the dashboard. So these are the data sources that we've used. Again, I said these are publicly available. So we've got things you might have heard, NRHA, the cost report data. Stroudwater actually extracts or downloads all of the cost report data every year. So we've got it going back, I think, until to 1999 or 2000. So we can pull information from hospital cost reports. Kaiser, some of the national sources. The Shep Center is a really great one with hospital closures, and then some of the U.S. government sites there, and then Washington, the University of Wisconsin, which is the Robert Wood Johnson Foundation, which are great. All right, so one more polling question, and then we'll get into it. How confident is your organization in finding and citing rural health data for decision making? I know it's a lot of polling, but I do appreciate the feedback because it helps us to know what to focus on with this. Patty, do you have any, how would you answer this?
I would answer it very confident. I had the pleasure of actually attending one of your sessions earlier, and it was right at the time when I needed it because I was putting together a narrative for the rural health transition funding that was coming up, and so I really had a great chance to get in there and get my feet dirty and use the tool. And I feel very, very confident now that I've worked through it, plus the training that I attended. So thank you so much.
Great, great, thank you. Okay. All right, so it looks like some are somewhat confident or not very confident. So let's go through. All right, so let's talk about the dashboard. So defining rural. When we started this, I did not realize there were so many different definitions of rural, even though I've been working with rural hospitals for my entire career. But we've used NRHC's definition. So for infrastructure, it's the physical address of the facility, and the NRHC's facilities download says whether it's rural or not. The workforce is at a zip code level. And so we're using crosswalks from NRHC, which identifies the zip codes that are rural. And then for that factors, we have some health factors, outcome shortage areas, and Medicare Advantage things. That's county level because those most of those sources are only available at county levels, although we do have zip code levels, but not here. And that uses NRHC's rural county methodology. And then we just assigned everything to a congressional district using the crosswalks from the government. And then in each of the tabs, you'll see that it will be able to highlight which ones are rural and which ones are non-rural using that color code there. And that's what we'll see that when we get to the demo. All right, so the first tab, we've got infrastructure, utilization, workforce, shortage areas, prevention, health outcomes, factors, Medicare Advantage, Medicaid coverage, and closed hospitals. The first is our infrastructure, and this is looking at NRHC facilities, including ambulatory surgery centers, hospitals, broken down by the different types, and FQHCs, rural health clinics, home health agencies, and SNFs. And then what we do is we're just showing kind of facility counts for all that are listed here. You'll see at the top here, you've got your different tabs that you can pick, and they're right there. And then each tab on the dashboard is going to have a map that's going to show your congressional districts that you can select, which will allow you to filter the dashboard. The data sources are always going to be in the bottom left, showing you what when the data was downloaded, how current it is, and where you can get the data, the raw data directly. And then as you mouse over the map, it'll show you a little bit of information about the different facilities that are there. And as you can see, you've got that up in the right-hand corner, you can select your state. And let me go back here. And the rural and non-rural breakout is there. So in the dark red is showing how many rural, and then the non-rural is the light blue. So you get a nice image of kind of what is the impact of rural facilities in your state, and then you can drill down to your congressional district. Gives you a nice overview of really the importance of rural facilities and rural healthcare facilities in your state and area. Next is utilization. So this takes a subset of those facilities, that including hospitals and FQHCs and RHCs and then SNFs. And for this, we're using the cost report data tied together with that facilities download. And this kind of gives us an idea of kind of the utilization, the activity within the different facilities, particularly with rural. So in this case, we're looking at Georgia here. 17.2% of the total hospital beds are in rural areas. 90.9% of the swing bed days are going to be in rural. And then FQHCs are about split. RHCs, obviously, you would expect those to be, the vast majority are rural. So for hospitals, we got beds, discharges, and then days using for labor and delivery, nursery, and swing bed. Now, labor and delivery and nursery days are kind of a proxy. There's no real good public data source for births. We wanted to include labor and delivery births, maternity activity here. So in this case, we're using those days from the cost report for labor and delivery and nursery days as kind of a proxy for births to show the activity, particularly in the time now when there's a lot of OB programs that are closing, and we wanted to highlight that these things are very, very important here. So in the visits we have for FQHCs and RHCs, and those are broken out by freestanding or provider-based. And the SNFs, again, also have days, total days per SNFs, again, broken out by freestanding or provider-based. And you can see in the you've got several different ways to look at it here. You've got the chart on the top, and then on the bottom, the table will show you the total volumes and then break them down by their different percentages. The next tab is workforce, and this includes data from the MPPES file, the MPI file. It's a download. And what we've done is we've taken kind of the higher level classifications here. So primary care, including family medicine, general practice, and OB and OBGYNs, behavioral health, oral health, and then the other ones, nursing, nurse practitioners, peds, and then some of the different specialties here. Grouping them up and showing them how many are within a rural area. So this is based on the office location of the provider here. It's not FTEs, and we'll talk about with Tim's organization in particular. Has some more targeted data or more state-specific data. This is a national data source that we're using, so there might be some more targeted information that you can get from your own state. We'll talk about that when we go through the demo. The next tab is shortage areas, and this is looking at from HRSA shortage areas. We've got primary care, dental health, and mental health, and then also the HPSA scores for each of them. And what this does is just takes that HRSA data download, and there's a lot more detail. I would encourage you, if you need it, to go to that download if you want to look at the raw data, because there's a lot more information about this. But we just kind of summarized it here so we can get a good shot of where the shortage areas are within the state by those different categories. And then if you mouse over the map here, you'll be able to see what the scores are. And then you can filter by the different types of shortage area types, or you can by designation or by status. And we'll look at that in the demo when we get to that here. We also included designated and proposed for withdrawal in here. So yeah, as I said, as you mouse over, you'll get some information about what are those HPSAs that are within that. Now, the next couple tabs are very similar, and what we're doing is taking the data metrics and then comparing them to a state benchmark for each state. So in most of the cases, you'll have, describing the colors, the orange color is going to be more of like a, lower than the state benchmark. Blue is going to be higher than the state benchmark, and that'll change depending on what the measure is. Usually blue is a better outcome, whereas the orange is usually a worse outcome. So, and these are prevention measures. So a lot of this is taken from the places data, which is the CMS data set, which is really great. It gives small area estimates based on a lot of the surveys that CMS does. They release this once every year. It's got some really good information. What I like about this too is that you're able to take get some really good information, and they are estimates, but it compares each area on a lot of different measures, and we've included most of them in here. There are additional measures that we didn't include, so those things, if you might need those as well. But what we have here, so we've got annual checkups, we've got screenings for cholesterol, cancer, we got dental visits, health insurance, blood pressure medication, and then mammographies. And then like I said, we're comparing those to state and national benchmarks. So the color is based on the state benchmark. So you can see in here in Georgia, anywhere that's blue, this is looking at annual checkups, that's higher than the state benchmark. And the title up at the top there will tell you what you're looking at. Yep, which I just highlighted there. Getting ahead of myself here. As in the first dashboard, you'll have mousing over the county will give you a little bit more information if you wanted to dig into there. You can select your measures here from this drop down. All right, and then the next one, like I said, is very similar. So we got health outcomes. This is tooth loss, which is important for dental care, different types of chronic diseases, some mental health, depression, suicide rates, things like that, blood pressure, some mortality rates, life expectancy, which is really, really fascinating, and opioid dispensing rates are some of the different versions here. So I just want to mention, I forgot to mention at the top, so we do have at the dashboard, there's a feedback, and the feedback thing is still open. So if you think of anything that you might think we should add to this, please let me know. We'll talk about that when we do the demo. Health factors. So this is looking at things like aging population, the broadband access, children's things, food insecurity, food stamps, housing insecurity, transportation barriers, a lot of different disabilities, a lot of great information, unemployment rate, taken again either from the Census Bureau or from CMS, or some of the other sources here. I will point out that unfortunately not every one of these is available for all states, and you'll see that if when you select the state. But most of the country is covered. All right, and then lastly, we've got the last three tabs here: Medicaid, Medicare Advantage penetration. This comes directly from CMS and just kind of shows basically how many eligibles are enrolled in Medicare Advantage within the state by county, comparing it to the benchmark. It's very interesting to look at. Medicaid coverage is only at the congressional level. This comes from Kaiser, some great data that they put out showing kind of the percentage of the population that's enrolled in Medicaid within each of the congressional districts, and then it kind of breaks them down by eligibility group. And then recently we've added closed hospitals. Now the Shepp Center in University of North Carolina tracks all the hospitals that have closed or converted, or either closed completely, converted to an REH, rural emergency hospital, or converted to some sort of inpatient healthcare facility, and we'll show those too. Great resource. So let's talk a little bit about using images and data. So each one, each of the dashboards has a download function here. You can download the data itself. You can download the image that you can put into your presentation. You can download it as a PDF, take everything as a PowerPoint, or you can download the Tableau workbook, which is what it's used in if you're familiar with Tableau, and use it locally. So let's go ahead and do the dashboard demo right now. This is the link here, and I would encourage people, we're going to put this in the chat. I would encourage people to follow along if you want to. Let me just share my screen here. Okay. Everybody see the dashboard? All right. Tim, Patty, Jolene, can you guys see that? The full screen dashboard? Okay, great. All right. So let's go here. Okay. So let's go through. So this is, as I said, we're looking at let's pick a state. We'll pick Georgia again, since we're looking at that. You select your state once, and then it filters through every dashboard, and then you've got your congressional districts here. And as you click on the map, it'll filter down to your congressional district, and then show all those totals here. And then, as I said before, mousing over will give you a little bit more information. And then you've got kind of your breakout here for your rural and non-rural. There's a couple of highlighting functions here if you wanted to highlight this information, and then from the download, which is you got to go out of full screen, you can actually download the highlighted image, which is a great way to customize what you're looking at, and then just drop it right into your application or your presentation that you're doing. Let's go over to utilization. Let me do that time here. All right. Once again, kind of same function here. You can filter by your congressional district. I'll pick this one here. All of your maps will update. You've got some information down here. And again, that highlighting function is kind of interesting because you can click on and say, okay, we just want to look at FQHCs here. Let's see what that data looks like. Or let's look at the hospitals, or look at hospital beds, for example. So you click on different ones, and get some really detailed information. We do tend to update these. This was updated through fiscal year 2024. There are new 25 data coming out, so we're probably going to be trying to update this either this month or later next month, as we can get some more information, more hospitals for fiscal year 25 coming through. Workforce. All right. Again, this is using the MPI file. These are our classifications. So you can, again, look at different classifications here, kind of highlight those. You can do multiple highlights. on the different classifications for your presentations. The districts are listed on the map here. There's also a drop down because sometimes it's hard to read, especially in larger states like California, which have a lot of districts. Or you can, if you only don't know the districts, but you do know your representative, you can select that, and then it'll filter everything. Tim, I was going to just ask you about the challenges with national data for workforce. Do you want to speak a little bit about that?
Sure. That was a good segue.
Yeah.
So, well, yeah, where to begin? Let's start with the Bureau of Labor Statistics, which is frequently viewed as a gold standard for workforce data, broadly speaking, not just healthcare. And one of the challenges there is that not everyone who does have to report to the BLS does. And there are a lot of reasons for another group of people that they don't have to. The size of the practice or the business, various exclusions. So the BLS data, while solid and consistent for looking at trend lines over time, doesn't necessarily capture the entire universe. Then in looking with the NPI data, the NUC taxonomy, the National Uniform, whatever it stands for, it is a great and very deep taxonomy that gets incredibly granular.
Yeah.
But then you need to back out of it and get up to a less granular level to get data that actually can be actionable. And if you juxtapose different data sources, we constantly are running into, well, Delaware's small. BLS says we've got 2,665 of this type of provider. Our data says we've got 3,000. Well, that difference, that 400, is probably due to reporting purposes. So anytime, and Stroudwater has indicated a willingness to do this, anytime that a state can give local data to Stroudwater for integration for a state-specific panel, that's a capacity that they have. We too are working with Tableau, so we have data that's sort of pre-cooked in the right format to export to another Tableau environment. We haven't done this yet, but we're certainly thinking about it. I hope I answered your question.
It does, yeah. And I know that we were talking backstage about that. In addition to Delaware, there are other states who are kind of doing these similar offerings.
Yes.
Can you speak about that? You know how many?
Yeah, well, so with rural health transformation and the CMS, 5-year program, if states weren't looking at this before, they're certainly compelled to do it now since all 50 states are getting funding. And I don't really see how any state could prosecute the opportunities without understanding their workforce, without understanding the incidence and location of chronic disease, of all the other elements that we've been talking about, much less projecting into the future with that data. It's one thing to look over our shoulders and see where we've been and maybe get a fairly present state of where we are. It's entirely another challenge to look forward based on things like, we talk about an aging population. Well, what about the aging healthcare workforce? There are a lot of people who are going to retire. So there are a number of dynamics to this that really compel us now to look forward. And frankly, with the advent of Claude and ChatGPT and whatnot, wrangling these massive data sets to be able to look forward suddenly is within the grasp of many more groups than it was in the past.
Great, thank you very much. So I think, yeah, the good takeaway is that this is a good, our dashboard is a good starting point, but you can get really more granular. And as Tim said, we have in the past kind of taken that more localized data and made a custom dashboard to really dig into the information. All right, let's move on to shortage areas, and I'll just kind of walk through this. As I said, this will show you kind of the different designations for each of the counties. Mousing over will kind of give you some information about the HPSAs and then the HPSA score, which are ranked from highest to lowest in terms of need. You can display by your congressional district. Let's look at number 2 here, for example. As you can see, every county almost every county except for dental health is a HPSA. There's different. You can filter this if you want to. Just look at kind of primary care by itself, and then the different designation types. So you've got all of your kind of your geographic ones, your facility related ones, and then I wanted to show also. So this allows you to show just the counties that are partially rural or rural. Which will kind of take it down a little bit. Let's move out of this so we can see that's a better representation. So just looking at the rural counties within the state here and the shortage areas. Now, Patty, I think this is something that you used, that application that we had talked about.
Yes, yes. And so I really use this in 2 ways. I used it for help in applying for grants, and also, as I mentioned earlier, to help me with choosing our next expansion site. So what I did when I was applying for the grants is I've used this HPSA data alongside some of the local measures and the community observations that I'd made. And what it did is it helped to support and refine the direction of where I was going to go with the Rural Health Transformation Funding proposal. In terms of our timeline, we have to be ready to apply. We still don't have any applications that have been released. And so I also used AI as a tool to kind of overlay with this. And I think Tim was also talking about this with Claude. I used ChatGPT in this case, and I used it as a tool to compare the information I had already gathered from other sources. And then then I compared that to the relevant Stroudwater data points, particularly the shortage areas. And then that helped me to identify which Stroudwater measures, even outside of the shortage areas, best reinforce the needs, my priorities, and my funding strategies that I reflected then in the grant narrative. And also it pointed out which measures I needed to further consider that I hadn't to begin with. So it helped to steer me in different directions based on the data. And then secondly, to help me with choosing an expansion site, we were looking for other fairly close locations to expand our services into, especially including, first of all, our mobile medical services. So I looked at this page for the HPSA scores in other Healy County areas. That's where our primary location is at. So several factors help guide our expansion decision, including the proximity to our main location, our current patient base, where they were located, how many in each area, and then on this page, our HPSA designation and the health outcomes that we believe that we can positively influence. And those were all available on the other tabs that you showed, Keith. And they were extremely helpful altogether because it brought out data I never even considered. So based on those factors, we decided to expand services in Tano Basin. So we currently serve approximately 1,000 patients, excuse me, 1,000 patients who are from Tano Basin. So many of those folks have to travel 40 minutes to an hour to reach our main patient location. So again, this data has just been exceedingly helpful for us not just the shortage areas, but that pointed us into one of the primary criteria that we had to meet. So thank you so much for providing this great resource to us, Keith.
Sure, you're welcome, and Stroudwater has to thanks. I think NRHA, the National Rural Health Association, and NOSORH were big in pushing this, and they kind of brought this to us and asked us for it. So I think it's been a nice partnership, and we're happy to have been able to participate in that. So these are the health factors, and that was actually good, or health outcomes. That was a good segue, Patty, so we can show kind of how these dashboards work. And the prevention outcomes and health factors are very similar in the way that they work. You've got your drop down here, so you can pick your different measures, and then everything will update here. So we're looking at Arizona, kind of looking at this is the life expectancy. Again, this is coming from the county health rankings and roadmaps, which is great data set. And then being able to say, show me just the areas that are fully rural. How do they and what do they look like? And so you can filter right there, and you get all of the information that you need. You can spend a lot of time just kind of looking through this, especially your own state, and just seeing the differences. I'm going to skip over to my home state, which is Pennsylvania, which has a lot of counties. And again, just the geographic changes are interesting. And again, as you mouse over, you'll get more information here to show you what the county is, kind of where this the measure detail, where it's coming from, what the year is, and just really very interesting. As I said, health factors is very similar. Let's look at some of the different populations here. So you drop down, you've got all these different types of measures. I'm getting low on time here. So I'm going to move ahead to Medicare Advantage. This was a request from NRHA that we add this, and this is just a simple download from CMS that they update these county level penetration enrollments every month, I think it is. So, but it really gives you a good example of the where Medicare Advantage has the enrollees are higher. So obviously in Pennsylvania here, you got more in the southwestern part of the state. The state benchmark is about 54.4% of total eligibles, and the national benchmark as of this data was about 51.2%. So a good information there. The next tab is going to be your Medicaid coverage. Again, this is looking just at congressional district only, but gives a good breakdown of the number of enrolled people in Medicaid by the different congressional districts, and then the data sources down here. Thanks to Kaiser for putting this together. We're just taking that data and just using it, but they are the source of the data. And lastly, we're going to look at closed hospitals. And again, I had mentioned the Shep Center, University of North Carolina, great organization. They track these closures on a regular basis. So it'll let you know kind of where the closures are. I'm going to pick a state. I think Georgia was the one that had more detail for some of them. Yeah, a little bit more information. So you can kind of track, year by year, which hospitals are closed, what type of closure there were. Some of them converted to REHs, so that's good, but it kind of gives you the information about the different closures there. So let's back out of this. That is the dashboard here. And I just wanted to show you, I talked about downloading. So below in the dashboard is here. So you can download the different, images, the data, PDF or PowerPoint. Oh, and I probably should have started with let's go over here. Actually, where it's located. This is our website here. Well, you guys have the link here, so this will just give you some more information about what we talked about. The dashboard's right in here. You can download from our webpage. If you open up the View on Tableau Public, you'll get maybe a different version. It's the same thing here. Real quick, this is the feedback and questions right here. This goes directly to me. So if you have anything that any questions after this presentation you want to ask, or some feedback, or some suggestions, please fill that into. We'd like to make this as usable for people as possible. We're going to keep going. And with that, I'm going to go to our last polling question. I know that was a lot of information, but what do you think would make this dashboard more valuable for your organization? If you have let me know what you think. This information will help us. And when we talked about Jolene's grant presentation that's coming up later this afternoon to help us to kind of tailor the dashboard so it's a little bit easier for people to use. Patty and Tim, any feedback on this?
From my standpoint, it would be really helpful if we had smaller geographic levels because we have our congressional districts are huge.
Yeah.
They're geographically so many miles in them. So the more localized we can get with that rural data, it would be more transferable and it would be all the more useful for us.
All right. Tim, do you have a opinion?
Yeah, the one thing that I would add to this, and I think perhaps you've contemplated this, is Tableau supports a new agentic product called Next. And right now, we would be taking data from your environment, pulling into ChatGPT, Claude, whatever. And a nice alternative would be to have that agentic companion right there at the Stroudwater website to compare things that, in a more natural language, intuitive kind of a way. That would be the add-on. But to what Patty said, in Delaware, 3 counties, the southernmost fairly large, and again, getting it down to zip code, census tract would be exceedingly helpful. Absolutely.
Yeah, I will point out that for this purpose, for this dashboard, this free dashboard, it is at the county level. A lot of the data, not everything, but a lot of the data is available at the zip code level. And we have done that for when we've worked with hospitals doing strategic planning, or we've done a lot of community health needs assessments. We will get down to that zip code level, which gives you a little bit more granularity. So that is available. And if you need help with that, please reach out to us. Jolene, your experience as a grant writer, do you have?
Yeah, I mean, the short answer is that I would want all of them because I'm like wild about data, but my priority is always going to be bridging the gap between raw data and a winning narrative. So for this, I think 3 main things would come up, and one is building that narrative layer. And so I want to be able to translate like a really high variance or bad health come sort of into an automated like statement of need framework. I want a tool that's able to help me explain what the data actually means for my community's like survival or their funding. I would want those data packages. Like if you've ever competed for a federal grant, you know how grueling it is and you know how time consuming it is to be searching all over the place. And so to be able to have something that's one click, like platform ready, something tailored to that would be a real game changer. And the last one, I completely agree with Tim and Patty. It's very easy. A county-wide average can easily mask like a massive healthcare desert in a specific pocket of a district. So moving towards those smaller geographic layers like zip codes or census tracts really could be like a holy grail if you're in rural advocacy. So I think it's something worth exploring.
Excellent. Thank you. And that actually leads into I wanted to put this up here. So this is your presentation that's coming up at 1 p.m., Crafting Compelling Grants. I think that's great.
And excuse me, Keith, I just let everyone know that if you did have any questions for our panelists, you can put that in the Q&A box and they will answer your questions now. Or if we don't have enough time to do that because we're getting close to the end of our session, we will be answering them later. But if you do have any questions, feel free to just put that into the chat box or into the Q&A box and we will get those answered. And then, yes.
Happy to take any, go ahead.
I was going to say, yes, Jolene, we're looking forward to your session. There is another one after this one, so I will chat about that after the Q&A time.
Yep, let us know if you have any questions.
Well, Keith, I'm not seeing any come through. We'll give everyone another 30 seconds to see. But do remember, though, that if you have any questions after that, feel free to reach out to Keith directly. There is that additional info box as part of the dashboard information that he shared. There is the grant this afternoon. But then, oh, and there's your contact information. Thank you, Keith.
Yeah, there you go.
But thank you, Keith, Tim, Patty, and Jolene, for just an insightful discussion around the growing role that data plays in shaping the future of rural healthcare strategy, advocacy, and funding opportunities. To you all who are participating in this, as a reminder, when you exit today's session, you'll receive a brief survey pop-up, and we would greatly appreciate your feedback. It should take less than a minute to complete, but it helps us continue to improve our conference programming each year to have sessions that are important to you. So if you will be joining us for our next session, we'll begin at the top of the hour. To join, please return to the conference lobby, select the next session from the agenda, and you will be added as soon as it begins. I will see you over there. Our next session does focus on one of the most significant long-term strategic risks facing rural healthcare organizations today, and that is physician succession planning. So thank you everyone for joining us today, and look forward to seeing you over at our next session.
Thank you very much.
Thank you.